دكتور بهجت آل من جامعة غازي عنتاب. Professor Behcet Al, he is the chair Prof of Emergency Department of Medicine School, University of Ghazi Antab. He's the chair of Clinical Toxicology of Medicine School, University of Ghazi Antab, and beside he's the General Secretary of Emergency Medical Physicians Association of Turkey. Also he's ATLS instructor. Dr. Behcet Al, he will talk about the operations was done for Syrian refugee in Turkey, الجراحات المجراة للاجئين السوريين في تركيا. We are very glad to have you with us, Dr. Behcet. Thank you for your time. Shall we start, please? شكرا جزيلا.
بسم الله الرحمن الرحيم. السلام عليكم to everybody. Thank you very much for your invitation and for your introduction. As Dr. Hassan introduced me, I'm Dr. Behcet from Gaziantep University at the Emergency Medicine Department. It is my pleasure to be with you at this time. My lecture is not a formal or official or scientific lecture. It is some statistic about the Syrian guests or refugees. All these documents were received from the Ministry of the Health, so all of them belong to the Ministry of Health. They are not my documents, so they are official. They are right. You know, the beginning of this crisis, Syrian crisis that happened in 2011, and as a Gaziantep city, it is very close to Aleppo. Everybody knows it. We care to many patients of Syrian patients. As I see, Dr. Mahmoud Hariri is here. Mahmoud Hariri, can you hear me? He is my friend. He knows everything what I mentioned. Actually, the name of the topic is surgery or the procedure, not just surgery, that's performed to Syrian refugees. Firstly, I will try to explain some the definition. Okay. The health service are provided in accordance with the principle regarding to health service to be provided to those under temporary protection. What I mean, there is a definition, the common definition, it belongs to the Union Nations, but this definition is not the same. It is not similar to the Union Nations because it is just belongs to Turkey. It is called as the those under temporary protection, or it is called or guest, not the refugees. In official terminology, it is called refugees, but in Turkey it is not. It is called as the guests or the people who are under temporary protection. Why? Because there are some different rights. If you say they are refugees, you have to provide them some different facility, or because the refugees has some different facility. But for the guests, they are called the guests because everything is free, and I mean especially the health service for them. So it is the definition is different. I cannot run my Dr. Hassan. Okay. Firstly, the first emergency or the health service was started by the control of the disaster and the emergency management authority. This is called in Turkey as AFAD. It is very big authority and very strong authority. Then it was transferred to the Directorate General of Migration Management in 2015. Because their function is very different. AFAD is controlling, the AFAD mission especially is to provide the foods, the clothes, and the accommodation, not the health system. So in the beginning, it was done by AFAD. In 2015, it was changed and transferred to the Director General of the Migration Management. It was established in 2015. The first healthcare service was started in city in 2011. And according to the last data that is given by the Ministry of the Health, now at that moment, the number of the Syrian who lives in Turkey are 3,587,266. They are temporary protected status. All of this, about 3 or 4% of this number, they are living in temporary housing centers. I mean, city tents. You know what is the meaning of the city tents? After we do not have Syrian refugees. We have many different countries' refugees, especially, for example, Iraqi refugees. They are over 60,000. In the beginning, the injured patients were transferred to the related hospital by 112. This is the emergency service of the Turkey. They were taken from the borderline, but now it has changed. Everything is changed now. The patient can apply directly to the hospital of that are belong to the Ministry of the Health. In Turkey, we have three different systems. We have 3 levels for the hospital. The first, the biggest one belong to the Ministry of the Health. They are serving about 75% of the service in the Turkey. As a secondly, we have university hospital. That belongs to a different authority. Then the third one are private hospitals. So the Syrian friends or guests or refugees, they can apply to the hospital that belong to the Ministry of Health directly. But for the university, for the private hospital, they should be transferred by any doctor from the Ministry of the Health. Otherwise, they cannot go directly to that. In a special condition, the emergency health service and adult, especially newborn, that need to intensive care unit, and the person who need to radiotherapy, chemotherapy, or radiotherapy treatments, they can transfer to the different hospital of the Turkey from the people who are now living in the Syrian, that is controlled by Turkey now. When we come to the number of the Syrian, according to as a distribution, according to the years, as you see, from the 2011 till the 2015, the number was increasing, but after 2015, the numbers, the increase was down. Look at here in 2018, the Turkey changed the style. What I mean, they closed the door due to some terrorist attacks or other problems. So now the close are not closed. You know, from the 2011 to 2015 or 18, the Turkey has a different system. They followed an open door. This was the system. But in 2015, they closed the door and sometimes opened them. When we came to 2018, all the doors were closed. So we are not following the closed door. So the system changed totally. That is why the number decreased. And from the 2018 to 2020, some of the Syrians, they left Turkey and they went to their country. About 60,000 Syrians, they still live in the 10th city. I mean, temporary accommodation, but mostly the majority of them are living in the center of the city now. Where do they live? As you see in the slides, number over 100,000 of the Syrian, they left in 10 city, Istanbul, Gaziantep. This is the second one. That is the city I am living now. For example, in my city, center city, about 450,000 of Syrian, they are living with us. I mean, the 26th of the population in Gaziantep, they are Syrian. They are living in the center of the city. Mostly are living in Istanbul, it is expected. And the other one, Hatay, Şanlıurfa, Adana, Mersin, Bursa, Kilis. Kilis is known, everybody knows what is the Kilis. Look at here. The number of the population of the Kilis was 142,000, and now they have 115 Syrians. So about 50% of the people are Syrian friends. They are living together hopefully, alhamdulillah, there is no any problem between the Turkish population and Syrian population there. As you see, their distribution is all over the city of the Turkey. Yes, this is an important, I think this can be a very, very, very important case for the world. As you see, the number is half and half, but they are living in peace. Even though they have so many problems, especially the works and the poverty, but they are living in peace, I can say. This could become a very, very, very important case in the world for the refugees. This is another distribution of the Syrian who live over 1,000 in some cities of Turkey. Especially they are living in the southeast, that is at the borderline. Gaziantep, Kilis, Şanlıurfa, Hatay, and Istanbul. Istanbul is a big city, so it is understandable that the Syrian, because they have chance to find works there. So many of them, they went to Istanbul. This is the distribution of the gender and the age. As you see, many of the people are young. Look at here, about over 500,000 people they newborn. They born in Turkey. So I think the number is now the exact number is over 600,000. Please look at this slide. About for the Syrian, about 85% of the Syrian, they are under 40 years old. What I mean, this is really, really very important. It is a chance. Also, it is a challenge. Why challenge? Because they are young people. They need job, they need education, they need accommodation, need houses. About 85% of the Syrian, that they are about over 3 million. It is very, very important. It includes very big challenge, a very big chance. Why chance? Because they are young people. They can introduce, they can work. This is also a chance if you organize, if you can be able to improve some project, it could become a very important chance for Turkey, also for the Syrian. But if you cannot do it, this is a challenge for also Turkey and for also the Syrian, because they are very young, under 14 years old. Yes. And this is the patients and their course happened since 2011 to 2020. As you see, this is the number of the patient they are increasing. This is understandable when the number of the patients increase as much as the number of the refugees come to the Turkey. And in last year, it was 10 million of the students they visited to hospital, all hospital, private hospital, family hospital. I'm really sorry. And the university hospital. When we come here, that as a totally after 8 years later, 9 years later, 46 million of the students they visited the hospital. This is a huge number, I think. But when we compare it with the Turkish number, it is less. But when you compare it with the Syrian number, you can say it's high. And over 2 million operation was done for all the Syrian. We now have over 532,000 newborn. This boy was born in Turkey. I think the number is over here because these are the recorded numbers. Some Syrians are not recorded; they do not have still identity cards, and the percentage of the death for the Syrian happened in since 9 years is about 0.5%. It is 18,000. So it is less than the Turkish death. This is less than the Turkish death. This is a good chance, but I don't know the reason. I think it is needed. It is necessary to check what is the reason of the death that the Syrians is less than the Turkish number. And this is the number of the hospitalization patient. It is over 2 million, and about 146,000 people they were transferred to the intensive care unit, and this happened in intensive care unit mostly. And this is another slides shows the number of the patients from 2011 and 2014 of February. Just in February, we have over 1 million Syrian patients. As I said, we have 46 million. There is an misunderstand or wrong understand. It is always told and written in newspaper, and it is said that the Syrians are going to the hospital many times. No, this is really not right. These are the official number. Like, check them. In 2018, you know, the Turkish population is about 82. Now it is 83. In 2018, we have 782 million patients that visited the doctors. It is really very huge. It is number one in the Europe and Western countries. The population is 82, but the patients who visited to the doctors is 782 millions. Of this patient, 139 million, they visited to emergency departments. And 423 millions, they visited the polyclinics, and the others visited the family doctors. When we come to Syrians, the number of the Syrians is 3,587,000. And the number of the Syrians who visited the hospital or the doctors in 2080 is just 9,889,000. Okay, look at check. So one Turkish in 2018, I mean, visited 9.5 times per year. When we come to the Syrian, as we see, the number is just 2.7. So it is 3 times the Turkish people, they visited to the hospital 3 times much more than the Syrian. So that is not right. That is the talk among the population that Syrian is going to hospital many times. No, it is not right. The Turkish are going much more, 3 times than the Syrian. So it is important to be known, to be called, talk, or to be written about this number, because there are some people, they want to have do a mixture between the Turkish population and the Syrian population. This is why they are saying Syrian are going to the hospital many times. This is another slide that shows the location of the third countries between 2014 and 19. About 60,000 Syrian, they went to some different countries by their own. They wanted to go there. Mostly they went to Canada, and but the total number is 16. But you know, there is another procedure. It is the phase 2, phase 1-to-1, changeable. I can say the change. Some Western countries, when they want to get some Syrians, they select the educated one. The most of this population, it is about 25,000. They went to the German, France, and the Netherlands. This is the data for the last 2 months for the Syrian. About 118,000 of Syrian, they visited the polyclinic, and 58,000 they visited the emergency department. 7,000 of them, they were hospitalized. 6,000 or 7,000 were transferred to the intensive care unit. And the date for 2 months is 811. This is a high number, because as I said, the mortality rate for the Syrian was 0.5, but this is high. I don't know the reason. This is high. Which kind of diagnostic test and diagnosis was done to the Syrian? Look at here. When we came 2018, about 1,349,589,000 diagnostic tests and diagnosis was done for the Syrian. As a total, we can say we can say as a total 4,347 or 49 million procedures or diagnosis or diagnostic test was done for all the Syrian, for 3.5 million Syrians. Which kind of, this is just a slice for only February. Group A operation is the biggest one. That is the vascular surgery, brain surgery, and big traumatic surgery. It's called in Turkey the Group A operation. Group B is moderate. What I mean, for example, appendectomy, cholecystectomy like this. And Group C, it is the simplest operation that is done for the Syrian. As yes, this is just for the February month, the operation done for the Syrian at second and third level of the hospital in Turkey. For 7 years, from 2012 till 2018, 1,955,000 operations, surgery operation was performed to the Syrian. Just for 2019, as a totally 4,042,000 operation was done for all the Syrians. But for 7 years, the total number is about 2 million. Yes, this is the number of the births happen in the different cities. As you see, Şanlıurfa is the first one. Istanbul and Gaziantep is expected because many of the Syrians are living in the cities. Over 500 or about 600,000 Syrians, they were born in Turkey. This is the cost for the operations or the procedures that is done for the Syrians. I do not to talk more about the cost, but maybe some of the friends, they are wondering about what did Turkey do for the Syrian for their health service, and this shows the number of the costs for the Syrians health system. Yes, which kind of the procedures done for the Syrian? I just take some of them. It is written in Turkish. That is over 100,000. So it is needed to be translated in English, but I didn't do it. If anybody wants to know, I can send the totally. That is include over 4 billion procedures that is done for the Syrians. Okay, I will come back again. Okay, as a result or conclusion, all this health service, even though organ transplantation, but for the Ministry of the Health Hospital, it is free for the Syrian. This is a good chance, I think. When you compare for the other countries, it's a good chance. It is all paid by the government. If any Syrians can be able to find a donor for their patients, and the government doesn't ask about money for the organ transplantation, but they should find the donor by themselves. I mean, for the Syrians. I think this is enough. There are so many things can be talked on. I should run my time. I think this is okay for my presentation. I'm waiting for your question. Thank you very much for your listening.
Thank you, Prof. Behcet. Thank you for nice lecture and very important numbers you presented in your lecture. So we'll open the floor for the questions. If there's any question for Prof. Behcet.
In the beginning, as I said, my lecture, my topic is not in a scientific
yeah, it's not clinical.
Yes, it was just a statistic about the Syrian. So this, inshallah, for another conversation or conference, we can talk about for the formal scientific topic.
let me start with you, Dr. Prof. Behcet, with my question. Is there any papers was done from this statistics or any numbers regarding?
Unfortunately, it is not. You should get the permission from the government. This is a critical question. As I know, they don't give permission for this statistic. They just send me on a special way. One of my friend, he's working in this office. He said me, I get this procedure for them. Okay. But I don't know the reason. What is the reason? The government doesn't want to this statistic to be published. But the reason I don't know. I don't know what is the reason. I think this is very important for Turkey and also for the Syrian, because you are giving a serve to the refugees, and this should be known by the authority, by the other countries or by other scientists. So it is better to publish this. But inshallah, I decided to get more documents and publish them if I could be able to get the permission, because it is still not allowed.
Okay, good. I don't know if there is any other question from any of the attendee audience.
Is there any Syrian participants here?
Yeah, sure. I think a lot of Syrian, either inside Syria or in Turkey also.
Yeah. I'm sorry. This slide is very important. 85% of the Syrian living in Turkey are less than under 14 years. I expected any question from these slides. This is really very important. As I said, it could become a chance and also could become a very big challenge for Syria and for Turkey. We have to work on this slides much more. As I discussed this issue with you, Dr. Mohammed, yesterday. This slide is very important, so everybody should pay attention. All authorities, the health authority and education authority, the offender authority. Because the number is increasing and increasing, they can produce, they can work, they are expecting the jobs, and so we have to work more on the slides. Hello?
Yes.
Can you hear me?
I don't know. Yeah, it's very clear. I think Dr. Muhammad Hassan, I think you have a question.
Assalamu alaikum.
Alaikum salam.
Assalamu alaikum. Thank you, Dr. Behcet, for this great lecture and these statistics and great information. I know that you are so involved in the Syrian context, especially in the healthy and medical side. Do you have any specific message you want to convey to the Syrian medical organizations or medical staff working inside Syria or inside Turkey, in the south part of Turkey?
Thank you very much. This is really very important question, not just for me, for everybody who wants to do some good thing for the refugees, not just for Syrian, for everybody. You know, these people, I think about 6 million of the people, they have to leave their country. They didn't come here as a guest. They didn't come here for the travel, for the visiting, for as a tourist. They have to come here because it was mandatory for them to come here. They came just with their clothes, without any house, any money, any production. They just comes to or go to the different countries with their own clothes and bags, small bags. So as a humanity, as a people, they need whatever we need. For example, look at your children, kids, and look at your neighbors, your brothers or sisters. Why do they need? The same thing is for the Syrian. We have to ask, what does the Syrian needs? They need whatever we need. Whatever we do, we have to do. Because they're people, they're human. They're expecting something. So especially, we have to focus on some very important point. The first one is education. The second one is sociological problems and the health systems. And I think the third one is the work, job and accommodations. Now, as I know, many thousands of the orphans are living in Gaziantep. I know some their association, sometimes we discuss with them. And many thousands and thousands women, they are without husband, they have to leave. And we have some injured patient, they lost their some part of their body. So we are not, we have to, I'm the medical doctor, so I can focus on the medical point or medical conditions. Even though I have some idea for education or sociological condition, but I'm a doctor, medical doctor, so I should focus on medical service what the Syrian needs, for example. For example, we have some medical students that are finishing their education in Turkey. Just the students who became the Turkish citizen that comes work here. The others cannot work here. Listen, a student, young people, they finish the medical faculty, but cannot work. This is really very, very important point at the best condition. And this condition depresses the students to have depression and many other things. So as a medical staff, we can educate the Syrian. I mean, the doctors, nurses, paramedics, and the technicians. How can we do it? By establishing some courses and online, on face-to-face, and establishing some course places and getting them to these courses places and showing some practice, what they need. And on the other hand, we can call the authority of the world to send some, medical devices, for example, what they need. And like this, for example, in this time, we have Corona. I'm really wondering if the Syrian who are living in camps, just outside border of the Turkey, do they have medicine for the Corona? Just a simple thing do they have adequate paracetamol for the fever? Isn't it? This is very simple needs, very, very simple needs. But I'm not sure if they have enough adequate paracetamol. And I missed the chloroquine because chloroquine may be difficult to be found. And the vaccination, the people who are living, for the kids living in Turkey, inside of Turkey, they get their all vaccination, but the other one who are living outside of the borderline, inside of the Syrian and the village, can this kid can be able to get enough or educated vaccination or not? I'm not sure. I think we are also not sure. Because you know the conditions. So as health staff, we should think whatever we need as a human, all the Syrians, kids and the adults, they need the same thing. So if we have chance. If the Syrian people, for the health condition, are not in safe, nobody is in safe. You see the corona came up in China. Now it distributed to all around the world. From just one people. If the Syrians are not in safe for the health, nobody is in safe. So we should think for them and for ourselves. So this is our job. This is our job that we have to do. Not, how can I say, so I just want to say a word, I forgot it. So let us collect our power and do some collaboration for the staff, the health staff who are working also inside of Turkey and outside of the Turkey. Please, let's come together and do something for them that they need. This is the time. 3 years later, the condition may be changed. They will not need you, but today they need us. We are here, we have to do it. But 3 years later, the condition will change. At that time, even though you will have so many facilities, you cannot help them. Okay.
Tamam, Dr. Behcet. We have another question in the
Sorry for
chat.
getting your
If
time.
you have, yeah.
Yeah, if Dr. Muhammad Youssef, if it's possible to direct the question directly to Dr. Behcet, if it's possible, please. Dr. Muhammad Youssef. تفضل. Can you hear me, Dr. Muhammad Youssef?
السلام عليكم ورحمة الله وبركاته.
I can hear you. I can hear you. Who's talking?
أهلا دكتور تفضل. يا دكتور محمد يوسف from Egypt.
السلام عليكم ورحمة الله. How are you?
عليكم السلام.
عليكم السلام Dr. Muhammad Yusuf. Thank you very much.
Hello, how are you? How is your health today?
Wallahi, I am suffering from the pain. It is really very painful.
Okay, I will just advise elevate your lower limb all the time, even while you are giving your fantastic lecture.
Thank you very much. I do it. By the way, I must to say that to the audience, I'm Dr. Behcet. I have COVID. My friends, I have COVID 4 weeks ago. Now I have deep venous thrombosis. I'm getting the medicine. So it is really very painful. Dr. Muhammad, I think he's asking about it. I'm elevating my legs, but I came to the table for this lecture. So it is really very painful.
Alhamdulillah.
I will recover by your dua, your prayer, inshallah.
May God bless you. Actually, I was raising 1 or 2 points. You have in Turkish universities protocol for educating and training Syrian doctors or not? And as you are a senior professor in Gaziantep University, you think can we FEMA and SEMA make a collaboration with your elegant university to establish a training center there?
This question is asked for a long time, for 7 years. It is asked by many different people from different society, from US. Dr. Muhammad, do we have time? Muhammad Hassan?
Yeah, sure. We have.
Yeah, doctor. We have time. Take your time.
Many friends ask these questions because I think this is very, very important for the people who are asking for, who are running for these questions. And they ask me many times. We have collaboration with the rector. You know, rector of this is the director of the university in Turkey. It's called rector. I talked with him and explained this issue. And why it is very important. The problem is that, you know, the university are controlled by an authority. It is called YÖK, the High Education Authority of the Turkey. It is called YÖK, and I think many of you know it. This is a high top organization and controlling all the universities, even private universities. So for this question, this issue should be discussed with this authority, I mean YÖK. But I explained this point to many of my friends who asked this question. Never of them, they went to YÖK, as I know, and explain and discuss with this issue. For the university, if any rector or university want to help, this helping is just become a very simple, not a comprehensive one. Because the university is controlled by this authority. So as SEMA or other association, they should go and have an appointment with the YÖK and explain their needs, why they need this collaborations. I think they accept. If you could be able to produce a good projects for this point, it is going to be accepted by the YÖK. If it will be accepted At that time, they said to all the university directors, please follow this project. At that time, your issue will become very easy.
Perfect, perfect. Very
but
good.
But now it is difficult because the rector or the director cannot do by themselves.
Yeah, but I think for an initial collaboration, both sides, I mean the Turkish university and SEMA should, I mean, agree to some major points before meeting the people from the Turkish authority controlling university. I mean, some sort of initial draft or MOU to say that we want your approval to this, or you suggest first to meet the authority, higher authority, then to go to universities after this.
No. This decision just can be taken by the highest authority. I mean, if the highest authority doesn't allow you, the university, the director of the university can just do some location thing. Some location, I mean, courses, some locations, conference or symposium. They can do it, but it is a location. But for common to become a good rule, it should be discussed with the authority, the highest authority. This is really very important. Listen, this is if you, I mean, some association or like some and other ones, they come together and produce a good project and have an appointment for the highest authority. I'm sure they will accept it. They will accept it. At that time, your issue will become very easy, very easy. At that time, it will belongs to you. You can have a negotiation with any university, whatever you want. But now, if they do not allow by the highest authority, we can do just some local activities, such symposium, courses, and conference like this. Okay, this is important, but this is the not thing that we need. And also this is nothing that you need.
Thank you
I
very
mean
much.
what you want. I understand what you want.
Yes, thank you very much for your sincere and very logic and constructive advice. Thank you very much.